Assalamu alaikum. If you have type 1 diabetes, type 2 diabetes or gestational diabetes, you may be wondering if it's safe to fast in the month of Ramadan. Before deciding to fast, it's best to discuss with your diabetes team or your GP, as fasting can be dangerous if you have diabetes, as it causes health problems whether your diabetes is controlled by diet alone, medicines or insulin. Ultimately, it is a personal choice whether to fast or not. However, if you do choose to fast, then you must consult with your doctor or healthcare team before Ramadan to make sure that you are able to look after yourself properly. Allah says in the Quran, "So whoever is present this month, let them fast, but whoever is ill or on a journey, then let them fast an equal number of days after Ramadan. Allah intends ease for you, not hardship, so that you may complete the prescribed period and proclaim the greatness of Allah guiding you, and perhaps you will be grateful." This means that a person living with diabetes, whether it's type 1, type 2 or gestational diabetes, is an ill person and therefore should not fast, as fasting can be harmful for you. And Allah also says in the Quran, "Do not let your own hands throw you into destruction," which essentially means do not act in a way that harms your body. The risks of fasting include, especially if you have complications associated with diabetes, such as poor vision or heart disease or kidney disease. The risk of aggravating this is very high and you should seriously consider not fasting. For people with diabetes taking certain medicines or insulin, fasting carries the risk of hypoglycemia or hypo, which is when your blood sugar is very low. If you feel that you are having a hypo, you must break your fast immediately and take some sugary fluids followed by starchy food, otherwise you will harm your body and may need medical attention. On the other hand, you may develop high blood glucose levels if you do not take the prescribed medication, or if you are less physically active than normal, which could lead to diabetic ketoacidosis, a serious condition requiring hospital treatment. If you do decide to fast, then do so after consulting with your doctor. If you are taking insulin, you will require less insulin before the start of your fast, or your usual insulin may need to be changed. Pre-mixed insulin is not recommended during fasting. Before starting the fast, you should include more slowly absorbed low GI foods such as basmati rice and dal in your meals, along with fruit and vegetables. You should check your blood glucose levels more often than you normally would. And when you break your fast, have small quantities of food and avoid only eating sweet or fried foods. Do not miss the suhoor meal before the next day's fast. At iftar, you should drink plenty of sugar-free and decaffeinated fluids to avoid being dehydrated. If at any time you feel unwell, dehydrated, experience symptoms of hypoglycemia, you should break your fast immediately and hydrate yourself with a sugary drink or 3 glucose or dextrose tablets or a pure fruit juice followed by a starchy food, as otherwise you will harm your body and you may need medical attention. If you experience the symptoms of hyperglycemia, where your blood sugar levels continues to be high and you're unsure of what to do, then contact your doctor or your diabetes team for further guidance. Remember, this information is all free, so don't forget to share, subscribe, like or follow Conscious Bites Dietitian.